Um, well, like I said, I am a second career nurse, and I enjoyed a 20-year career as a chef and restaurateur in the San Francisco Bay Area. I truly embraced the farm-to-table movement. I truly jumped into all the creativity and all the energy that I found in San Francisco. And I think that there was something missing in a sense. There was something still nagging, and I felt that in the end, and also because I was turning 40, that I could really make more of a difference, and I want to say be more effective in changing lives as a nurse and helping patients to make what changes they want to make in their lives as a nurse compared to as a fine dining chef.
I was surrounded by healthcare. My father's a physician, and I always knew I wanted to work with kids in a healthcare setting. He really pushed me to examine alternate routes of providing healthcare for patients, and he worked with the nurse practitioner in the local hospital where he worked, and he had me shadow her for a day or two, and I just fell in love. So that was the impetus to become a nurse practitioner.
It's something that happens as a Columbia nurse, that it's part of your soul.
I was offered a job at Goldman Sachs, so I decided to move to New York and try out finance. About a week after I graduated college, I had a stroke. I was born with hypertrophic cardiomyopathy, which is a disease where the ventricle is too thick, and so that caused a stroke. I had spent about a month in the hospital. The nurses were really the ones that were involved most in my care from an emotional and physical standpoint, really making sure that I recovered, not only physically but emotionally.
Now, why did I want to come to Columbia specifically? Because of the reputation I know of the hands-on and the clinical experiences. Nowhere else would we have clinical sites as wonderful as we do here at Columbia. I want to say that a lot of my classmates, many of my classmates, are international students. They've traveled extensively. Many of my class had come from missions abroad. And what they and I found coming here was that you didn't have to travel too far to obtain the experiences that you wanted, or to experience the patient populations that you wanted to experience.
The biggest thing that Columbia pushed was critical thinking and thinking outside of the box. And I always said I never wanted to do research, and that's why I got a clinical degree. But having taken research classes and exposing me to that really made me appreciate not only the way research is done, but also how to interpret the research. And that, I think, plays a big part in the healthcare that it provides patients. Columbia is at the forefront of nursing education. They were one of the first to have the DNP degree, and I think that having an advanced clinical degree for nursing is really important.
I've been a nurse for over 50 years. I graduated from Columbia in 1964 with one of the largest graduating classes. And since then, I've gotten my master's and my doctorate. I've taught at Columbia, I've taught at NYU, I've taught at Pace, I've taught at Teachers College, and I've also been teaching internationally in Mexico and also in South Africa.
I graduated Columbia Nursing School in 1974. Going to Columbia Nursing School in and of itself meant something. It was very prestigious. And I know that my classmates and I all felt that all throughout the whole time we were here, that we were in a special place, and we were being taught by special teachers who cared about us and who cared about the experiences that we got.
Columbia prepares us through the coursework, but also through this, what they call integration, where the last 3 months of our bachelor's program we go and fully integrate into a hospital. That experience is unique to Columbia in that it really prepares you for the real world applications of what you're learning in the classroom, and I feel like a lot of places you wouldn't really get that hands-on experience before you went into practice.
Became a paramedic, EMT, And then after college, I volunteered in the kind of local EMT ambulance corps around my college, and I started my own software consulting company. About the same time I started my software consulting company, I joined the military, United States Army, and became an infantryman. Right when I got out, September 11th happened. I went back in active duty for another 4 years. Actually, the reason I joined the military was it was my form of community service. And so I felt, I'm an immigrant, and I felt that it would be my way to give back to my community at large.
I have at least 4 or 5 very close friends that were in my class, and my very best friend, who I met in Columbia Nursing School within the first week of being here, is my best friend today. It was very scary when you first do that. And you go to nursing school thinking that I'm going to be a nurse, I'm going to be taking care of patients, and these are words until you're actually at the bedside. So I became a nurse in the ICU of the coronary care unit at what was called New York Hospital. And I was a nurse for about 4 or 5 years, and I loved it. And then I went into hospital administration and became what in those days was called a patient representative.
I have friends who do oncology, I have friends who do adult cardiac care, I have friends who do adult primary care, and so it really gives you an opportunity to not only make friendships but also learn from your classmates. Yes, actually 2 of my best friends from the DNP program, we get together about once every month or every 2 months, and we just discuss what's going on in our lives. And I use it as a sounding board for frustrations that I have, but also for interesting cases, and we just bounce ideas back and forth. We joke about opening our own practice.
I want to say that I found a home in many of the faculty, in the sense that I was able to find people who thought the same way I did, were open to new experiences the way I was, and still am. And literally, they did open their homes to me. And one thing that I really appreciated, and it reminded me of the small town that I came from, was that they would open their access to us students. Here's my cell phone number. This is where I live. Call me anytime. Not just office hours. I'm available here. I'm available when you need me after your clinical site. Let's talk about what happened today on the floor in the hospital. And so I really appreciated that. I appreciated how they treated us as peers in the very beginning and not just students.
There are a lot of nursing leaders when you look at Columbia alum that are nurses, and when I go around and I run into nurses that have been nurses for 30 years that came from Columbia, I've always been impressed by what they've accomplished. So that's what makes me very proud to be part of that lineage of Columbia nurses.
I became the assistant director of a department for about 4 years, and then a director, and then a vice president of the hospital, at which point New York Hospital merged with Columbia Presbyterian, or Presbyterian Hospital of New York. Then with another colleague, I built the global program, or the international program, for the hospital from the ground up. Literally building the space, hiring the staff, writing the policies, and beginning an international program for New York Presbyterian, which has now been in existence for about 16 years. So that went on until I became a senior vice president, working for Dr. Herbert Pardes, was the president and CEO at the time. And my title changed to Senior Vice President for Patient Services and Special Assistant to the President and CEO.
I am a pediatric nurse practitioner. I work in a pediatric primary care practice out in Brooklyn. We do everything ranging from newborn well visits to pre-college physicals, sick visits. I also do some nutrition counseling for obese adolescents and some mental health teaching and screening for kids. Columbia School of Nursing for 3 degrees. I got my ETP in 2003. I got my master's as a pediatric nurse practitioner in 2005, and I graduated in May of 2013 with my DNP.
Thank you.
Okay.
I am a Columbia nurse. I am a, I can't, I am a Columbia nurse. I am a Columbia nurse. I am a Columbia nurse.
There are a lot of nursing leaders when you look at Columbia alum that are nurses, and when I go around and I run into nurses that have been nurses for 30 years that came from Columbia, I've always been impressed by what they've accomplished. So that's what makes me very proud to be part of that lineage of Columbia nurses. The focus of my research is on using technology to answer nursing informatics question. Another kind of subset of my specialty is mobile health. So how you can take those, how you can take informatics and use mobile devices like phones and tablets for clinicians. And I'm also generally very interested in how you can take all of that technology and help the underserved. And so how you can take health information technology and help improve the health status of underserved communities.
I'm starting my 4th doctoral program, PhD program, and a lot of this confidence came from being a Columbia nurse, because we were told from the very beginning that we were leaders. And as leaders, we knew that we had to be willing to take risks. We had to be in the forefront. But I've always liked helping people. You know, whether I'm working in, shanty towns in Cape Town, South Africa, or I've been doing a lot of work in Haiti. It's the public health experience that I had at Columbia. It was like we just went into poverty-stricken areas, and it was never a question about would we go there or not. It was just part of our job. And we loved it.
For my first 2 years while here at Columbia Nursing, I was a graduate research assistant on nationally funded research grants, NINR funded. And it really gave me a lot of exposure to, how do you collaborate with research members? How do you conduct solid research? And I think that that's really given me, a great foundation with which to move forward and really to, improve care quality in the emergency department setting.
I'm very much involved in mentoring students from Columbia, and actually I keep in touch with the class behind me. I think that the choice to come to Columbia is one that you shouldn't take lightly. I think that it will transform the way you think. You will be exposed to everyone and everything and every patient population, and I'm so grateful for that. What you will remember, not only, what you'll carry with you is a sense that you have the skills you need. I am a Columbia nurse. I am a Columbia nurse.
How about I am a Columbia nurse?
I am a Columbia nurse.
Good.
My background comes from my Columbia roots. It was learning about leadership as a baccalaureate student, sitting in class and having some of the most wonderful faculty. I will always be a Columbia nurse, and I just can't say anything more about it. So I've always been a Columbia nurse, and I will be until the dying days, so to speak.
I feel very excited as a nurse informaticist, because I feel like I'm in the center of the future of nursing. I'm in the center of what's happening, in society, intersection of all kinds of interesting trends with how people manage their health, how people access technology.
Who are you?
I'm a Columbia nurse.
Who are you?
I am a Columbia nurse.
Who are you?
I'm a Columbia nurse.
Sure. So now that I have my PhD, I'm very excited to report that I have a joint research position both here at Columbia Nursing and also at New York Presbyterian Hospital. At Columbia Nursing, I'll be an associate research scientist, and then also at New York Presbyterian, I will be a nurse researcher where I will facilitate the conduct of research among bedside nurses. I am proud to be a Columbia nurse.
Okay, one more time.
I am proud to be a Columbia nurse.
You don't.
I am proud to be a Columbia nurse.
My daughter graduated from college 2 years ago and thought she wanted to go into psychology. She set out to shadow and interview people who did all kinds of different things. Nurses, doctors, psychologists, midwives, nurse practitioners, surgeons, every possible imaginable occupation, but more toward the clinical field, toward the clinical area. And when she finished this journey, she said, I want to be a nurse practitioner and I want to go to Columbia. I am very proud to be a Columbia nurse.